Hi everybody, it's Dr. Eric Balcavage and we're back for another edition of Thyroid Thursday. Today I want to talk to you about something I see in my practice quite often, and it's called drug-induced anxiety. If you've had depression, been put on an SSRI, and you struggle currently with anxiety, insomnia, GI dysfunction, maybe chronic pain syndromes, and there could be a number of symptoms, this could possibly be the reason that you're struggling with those things. So let me explain what happens. Somebody who has a chronic inflammatory condition is going to speed up an enzyme in their body called MAO. MAO is the enzyme that metabolizes serotonin, and it's serotonin that makes you feel happy. And so if you speed up the rate of MAO, you deplete your serotonin much faster, which is going to make you depressed. When you're depressed, you go get a medication called an SSRI to block MAO activity and allow your serotonin to hang around a lot longer. It sounds good, right? Depression goes away and you feel better, at least initially. And then you start finding you can't sleep at night, you're irritable, you've got chronic pain, and you are anxious. Why is that happening? Well, serotonin slows an enzyme called COMT. And COMT is the main enzyme, or one of the main enzymes that helps metabolize epinephrine, a fight or flight hormone or neurotransmitter, out of your body. So if you slow COMT, you're going to hold on to your fight or flight hormones longer. So when you're in fight or flight mode chronically, you're not going to sleep. You're going to be in a high state of awareness, which is your anxiety. You don't need GI function, so your GI tract is going to be challenged. You're definitely not going to sleep, so you're going to develop insomnia, and you're going to lose your libido, okay? And so the prolonged exposure is going to wind up with these types of symptoms. Why do some people take an SSRI and not have symptoms of anxiety, insomnia? Well, there's other things that can slow down that COMT enzyme as well. High levels of estrogen, deficiencies of SAMe, magnesium deficiencies, B12 deficiencies, folate deficiencies. All these things can compromise this COMT enzyme. And if you had one of those, maybe not a big deal. But if you have 2 or 3 of those things going on or more, all those things slowing that COMT enzyme, you're going to ramp up that epinephrine and put yourself in a chronic fight or flight response and wind up with anxiety, insomnia, chronic pain, GI dysfunction, and a number of other symptoms. So if you're struggling with anxiety and insomnia and the symptoms I explained, and you need help, give my office a call, 610-558-8920, or send us a note via the website, and we'll get you in and see what we can do to help you recover with your drug-induced anxiety condition. All right? Hopefully that helped. This is Dr. Eric Balcavage, and we'll see you next Thursday on another edition of Thyroid Thursday.